Study Session 13. Adhering to Medical Advice. Introduction. Some people comply with medical advice, while others fail to comply. Several factors may be held responsible for this. For instance, non-adherence or failure to comply with medical advice may be due to illness characteristics, duration of the treatment, and complexity of the treatment, among others. In this study session, you will learn about the concept of adherence, factors predicting adherence, and possible ways of improving adherence. Learning outcomes. When you have studied this study session, you should be able to define compliance or adherence, identify the factors predicting compliance or adherence, and list some ways by which compliance or adherence can be improved. Concept of compliance or adherence. Traditionally, the term compliance refers to the patient's behavior that conforms to physician's orders. But because the term connotes reluctant obedience, many health psychologists and some physicians advocate the use of other words and terms such as adherence, cooperation, obedience, and collaboration. However, the term compliance and adherence are still the most frequently used words. Both words are used interchangeably to describe the patient's ability and willingness to follow recommended health practices. Turk and Meichenbaum, 1991. Haynes, 1979, defined compliance as the extent to which a person's behavior in terms of taking medications, following diets, or executing lifestyle changes coincides with medical or health advice. This definition expands the concept of compliance beyond merely taking medications to include maintaining healthy lifestyle practices such as abstaining from smoking cigarettes, eating properly, getting sufficient exercise, avoiding undue stress, and not abusing alcohol. Factors predicting compliance or adherence. Possible predictors of adherence to or compliance with medical advice or health practices can be of three categories, namely characteristics of the disease, characteristics of the person, and characteristics of the relationship between the healthcare provider and the patient. 1. Illness characteristics. Characteristics of the disease include the unpleasantness of the medication's side effects, the duration of treatment, the complexity of treatment, and the severity of the disease. A. Side effects of the medication. A drug with few or no unpleasant side effects will produce greater patient compliance. A study by Kirsch and Rosenstock, 1977, revealed that unpleasant side effects are associated with a greater likelihood of non-compliance. B. Duration of the treatment. This is the second illness characteristic. In general, the longer people must submit to treatment or preventive regimens, the more they are to drop out of treatment. According to Haynes, 1976, in most cases, non-compliance increases as the duration of therapy increases. C. Complexity of the treatment. Another illness characteristic is the complexity of the treatment. In general, The greater the variety of medication, the greater is the likelihood of that person's non-compliance. Haynes, 1976, showed that compliance decreases as the number of daily doses increased from 1 to 4. 2. Personal characteristics. Individual characteristics such as age, gender, social support, personal traits, and personal beliefs about health determine how people comply with medical advice. A. Age. The relationship between adherence and age is complicated by several factors. Depending on the specific illness, the time frame, and the adherence regimen, studies show that compliance either increases or decreases with age. B. Gender. With regard to gender, researchers have found few differences between overall adherence rates of women and men, but some differences in specific recommendations. Lynch et al. 1992 found that men and women were about equal in their tendency to drop out of or stay with an exercise program. However, women seem to be better at adhering to healthy diets and taking some types of medication than men do. C. Social support. One of the strongest predictors of adherence is the level of social support one receives from friends and family. In general, people who are isolated from others are likely to be non-compliant. Those whose lives are filled with close interpersonal relationships are more likely to follow medical advice. For instance, Christensen et al. 1992 found that hemodialysis patients who saw their family as cohesive and expressive of feelings were more likely to adhere to fluid intake restrictions than those who perceived conflict within their family. D. Personality traits. Some studies have shown that personality traits such as authoritarianism, neuroticism, and impulsivity are associated with non-compliance. However, most of these studies did not show standardized personality inventories. E. Personal beliefs and cultural norms. Some evidence suggests that patients' beliefs are related to compliance. Therefore, personal beliefs that one's own behavior can produce a health benefit is positively related to adherence. One other factor that definitely relates to compliance is the patient's cultural beliefs and attitudes. For instance, if one's family or tribal traditions include strong beliefs in the efficacy of witch doctors or herbalists, individuals' compliance with modern medical recommendations might be very low. 3. The practitioner-patient interaction. A more satisfactory group of predictors of adherence are those subsumed under the category of practitioner-patient interaction. Within this category are such factors as the verbal communication between the healthcare provider and the patient, the perceived practitioner's level of competence, the amount of time between referral and treatment, and the length of time a patient has to spend in the practitioner's waiting room. A. Verbal communication. Lack of accurate verbal communication is probably the most serious problem in patient compliance. Many patients fail to understand or fail to remember instructions because of inaccurate or inadequate communication between them and the healthcare providers. B. The practitioner's personal characteristics. This has to do with the level of competence of the physician. As might be expected, patients' compliance improves as confidence in their physician's technical abilities increases. Gilbert, 1989. Although patients are more likely to adhere to recommendations from competent and knowledgeable physicians, they become less eager to comply when the physician's expertise is expressed in an authoritative fashion. Brannon and Feist, 1997. C. Time spent by the patient before seeing the physician. The length of period the patient must wait to secure an appointment and the amount of time they must spend in the practitioner's waiting room are two final predictors of compliance. In both cases, the longer the wait, the greater is the possibility of the patient's non-compliance. A delay of about 1 hour can bring about non-compliance. How to improve adherence? Several methods can be used to improve adherence. Among such methods are educational and behavioral strategies. Haynes, 1976. 1. Educational strategies and instructional procedures. These are procedures that impart information, sometimes in an emotion-arousing manner, designed to frighten the non-compliant patient into becoming compliant. Such strategies and procedures include A. Health education messages. B. Individual patient counseling with various professional healthcare providers. That is, counseling by doctors, clinical psychologists, medical social workers, nurses, counselors, etc. C. Programmed instructions. D. Lectures. E. Demonstrations. And F. Personal instruction. Although educational programs increase patients' knowledge about their disease, none of these programs has been found to bring about long-term compliance. 2. Behavioral and cognitive strategies. The ineffectiveness of educational and instructional procedures has instigated a growing interest in various behavioral and cognitive strategies for improving patients' compliance. These interventions include A. Self-monitoring. B. Home visits. C. Cues and rewards. And D. Peer group discussions. Haynes et al. 1987 found that cues and rewards seem to be the most consistently effective means of improving compliance. Cues include using one's toothbrush or a completed meal as a signal to take one's medication. Rewards might include small sums of money given by the healthcare provider or self-reinforcement such as seeing a movie or treating oneself to a nice meal. Both cues and rewards have been shown to increase the chances that patients will take their prescribed medication. Study session summary. In this study session, you learned that there are different submissions on the concept of adherence. You also learned the factors predicting adherence have to do with the illness characteristics, patient's personal characteristics, and the practitioner's characteristics. End of study session 13. Thanks for listening.